Hi guys, I am currently 3 days post-op from VSG. I had it on October 30th, 2018. I am doing pretty good. Everybody is so different. My journey is going to be different than yours, but I just wanted to kind of tell everyone how my surgery day went. I did surgery as an outpatient procedure with Dr. Beltre in Altamonte Springs, Florida. My actual surgery was at Lee Contour Surgery Center. I personally feel like I had a pretty rough surgery. Some people go through surgery without any pain, any problems. Personally, I wasn't doing so good the first 2 days, but I'm doing so much better now. So I'm just going to kind of tell you what happened and what I've been doing to get through it. So the first thing I had to do is go through my medications. So I bought some multivitamins. These are the berry melts because I knew chewing and being sensitive, I didn't want that. So I got the berry melts. They just melt in your mouth, multivitamin. And because this has a good amount of vitamins because they're specifically for bariatric patients, this is the only vitamin I really need other than I bought like a biotin to help with my hair. I don't want to lose my hair. But these have been pretty good. I have my pain medication. I've used about that much. I try to, honestly, right now I'm already off of it. I'm just trying to use it to help me sleep because at night I get some pain. The other pain medication I have is this Dilaudid. They're very, very, very tiny pills. I'm able to get them down. I'm off of those as well. Sometimes if I wake up in the middle of the night in pain, I'll get up and take them. I also have an omeprazole. It's for acid reflux. I'm supposed to take one pill about 30 minutes before breakfast, but they're capsules so I can open them before breakfast to protect my new pouch from any reflux while it's trying to heal. And I have, this is a Zofran. It's a dissolve under the tongue Zofran. These actually made me sick, so I haven't been using these. Instead, I have a Finnegan suppository. If you don't know what a suppository is, that's it's like a little pill that you have to put in your butthole, and it gets absorbed through your rectum. Which it sounds terrible, but honestly, when you're nauseous, you don't care. And they were really helpful for me. I also bought, the Gas-X. I bought the chewable because I don't like mint. They were really good. They honestly just kind of dissolve in your mouth too. So these were really helpful. I only used them the first day, but you'll hear I was having some real vomiting. So I kind of stood away from them. So, first thing we'll go into my surgery day. So surgery day, I was an outpatient procedure. So I went to my surgery center. I was scheduled for 8:30. I got there at 7:30 and I sat in the waiting room up until 8:30. And then they finally brought me back. My family had to wait in the lobby because I was outpatient. Like, it wasn't like go back and have your own room or anything like that. So I was sent back to like this room where they weighed me, took my vitals. I was given a gown, some compression socks, a hairnet, and a feet covers to put on myself. And after that, the surgeon came to talk to me. The anesthesiologist came to speak to me, and the nurse came in and brought me, I walked myself over to the OR, which was freezing is all I can really say about it. It was, a small room. There was only 3 or 4 people in there. And as soon as she had me lay down on the table, and the anesthesiologist then went to put an IV in. I got a couple bruises. It took him 2 tries to get a good IV in my arm. And as soon as he got the IV in, I felt them put the SEDs, which are the compression that squeeze your calves, on my legs. And after that, all I remember is him telling me, "We'll see you in an hour and a half." And I felt a warm feeling, and I blinked twice. I felt, a slow blink, and then I was out. And the next thing I remember, I woke up in the recovery room. Apparently, I had a very hard time waking up from anesthesia. I was there longer than any other patient who was there that day. There was 4 surgeries scheduled, and I was the second one to go in, and I was still the last one to leave. I was having a really hard time waking up. Um, I remember, nurses trying to wake me up, them yelling at me, telling me I need to wake up, I need to wake up. And I remember I would like open my eyes for a second and then I was out. Like I just could not stay awake for the life of me. All I remember is telling her that I was freezing. Please, I'm cold. Give me a blanket. I was so out. That's all I can remember. The rest is what my family has told me that happened. So I was freezing, and apparently I was complaining about pain, so they maxed me out on pain meds and nausea meds, which was also making me so sleepy. I don't remember complaining about pain at all. I only remember complaining about it being cold, but apparently I was in pain. Don't remember any of it. I remember just in and out. She kept yelling at me, and I'd open my eyes and go back to sleep. And then eventually she made me get up to go to the restroom, and I remember I was very, very dizzy. Like I felt like I was going to fall over. I was trying to hold on to her. I was like, don't let me fall. And I went to the bathroom, and then she put me immediately in a wheelchair, even though I was so out. And I remember I fell asleep sitting in the wheelchair. And the next thing I know, I was outside. She was trying to wake me up again to get me in my car. And I mean, I think it's crazy how fast they rushed me out since I was so out of it. But, it is what it is. So I got into my car and immediately sat in the car and apparently vomited everywhere. Like dark, black, bile with blood in it, vomit. The nurse told me that the whole car ride, that my main goal was to stay awake. I was awake probably 5 minutes out of the 45-minute car ride. There was no way to keep me awake. I had so much going on. I wanted to go to sleep, and apparently I was a complete asshole in the car to my mom. I kept telling her to leave me the fuck alone. I don't remember any of it. I just remember sleeping. But apparently I was very mean. She was trying to keep me awake, but I was not having it. So I honestly don't even remember any of this or coming home. The next thing I remember was waking up. But apparently I came home and I went to bed, and about every hour I was waking up to vomit. Like I was just vomit. I vomited probably 13 times between getting home at like 1 o'clock in the afternoon and midnight. I vomited like 13 times. And it was all that dark colored vomit with blood and some of the mucus from being intubated. I don't really remember as much because I remember I would just be asleep and then I'd vomit and then I'd go back to sleep and then I'd vomit in bed. I am very, very sore. I can feel from vomiting so much, but I feel like I personally just had a rough case. A lot of people don't vomit at all when they have surgery, so I don't want to scare anybody. But I want people to know what happened to me. So I was vomiting for about 24 hours, and then when I was able to have, my PO meds, I was starting on ice chips. I was not getting in any fluids. I was a terrible patient. Only a few ice chips, and then I was telling everyone to leave me alone, and I went back to bed. So the whole first day post-op, honestly, I slept, I did a few laps of walking in my kitchen, had a few ice chips, and went back to bed. Because my main goal was trying not to vomit anymore, because I had already lost so much fluid. So the whole first day post-op was walk, sleep. So second day post-op, I was doing, much better. I had to go in for my x-ray to see if I had any leaks. The car ride was awful. I sat there the whole time holding my stomach in on every single bump. It was a terrible car ride. The exam was pretty nasty too. I was more also concerned about not vomiting anymore. So it was a tiny sip of the contrast, which tasted disgusting. And then they'd scan you, and I had to take like 15 tiny sips. But it was only like this much fluid, like it was the tiniest sip. So they were taking those pictures, and I surprisingly did not vomit. Actually, the contrast helped me get a lot of air out. Like I kept burping, and I kept telling her I'm gonna vomit, but I never did. I just kept burping. After the contrast, I went home and went back to bed. Day 3, sorry, I've got a lot of mosquito bites from Halloween. So the day 3, day 3 is today. I had to go to my doctor this morning for my day 3 post-op visit. And, I told him about all my vomiting and how I've been doing. He decided to keep me on clear liquids a little longer. I'm getting in more fluids than I was. I finally started drinking. some Powerade. I'm about to hear. It's about all I've had since surgery. Like, I'm a terrible patient. So he decided to keep me on clear liquids for a couple more days just to make sure I'm getting in what I need. The vomiting has completely stopped. I feel so much better than I did. I'm walking, I'm able to move, I've taken a shower. I even went to the store. Well, I didn't. My mom took me to the store, and I was, just walking around the store trying to get some air out. I've been going for walks with my dog, and I feel so much better. Like, it's between day 1 and day 3, the amount I feel better is just crazy. Like, after surgery, if you're feeling discouraged and you feel miserable, I promise you it gets better. I thought I was going to die the first day. I just personally had a rough go. Some people, it's just so easy for them, but I had a really rough go. But I'm already feeling so much better, and I have zero regrets. I am so excited to get this weight off. So I've told you about my medications. So far on day 3 post-op, he told me to stay in clears. So I showed you my Powerade. The other thing he gave me was this Premier Protein Clear. It's a protein, Premier Protein like the regular, but it's a clear one, so you can have a clear liquid diet. It's got 20 grams of protein, 0 sugars. I have to dilute it in water because it's very, very sweet. And it kind of does leave like a little weird proteiny feeling on your tongue, but to get the protein in, it's really worth it. I haven't gotten much in yet because it kind of made me sick. Because I'm still trying to get used to everything. My stomach is apparently very sensitive. I've done that with Powerade. I'm on the ice chips. Everyone likes popsicles. I haven't had any popsicles. I've been really liking the warm stuff. It's every time I eat something warm, I automatically start burping this gas out. So I started with this cup of soup. It's like 3/4 of a cup. You just put it in the microwave with water, and I strained out the noodles and just eat the broth, and it is so good. I tried the box broth. Disgusting. Don't do it. That's not what it's made for. So I got these, and it's been really good, and the warm really just pushes all of that gas out. So my gas pain hasn't been very bad. That's pretty much all I've gotten in so far. My doctor also told my mom I could have a hot chocolate, so it was like a water-based, no sugar added hot chocolate that I had, and it was really just to try to get anything he could inside of me. I mean, it's not what he recommends, but he told her, do what you can to get her to drink, because the first 2 days was so rough. So, as for pain, my pain has been, other than obviously the vomiting, I haven't been feeling too much pain. It's more soreness right here, where where your actual stomach is. It's like a soreness, like you're going to the gym and you overly worked out or pulled a muscle. That's what it feels like. And for me, I'm sure a lot of it is because of all the vomiting I did, all the muscles tightening. So that's the only pain I really felt. I felt some gas pain, but it's really not even pain. It's more like a gurgle. Like you can feel the gas in your belly, like it gurgles, then you burp. So it hasn't been like pain, like I'm gonna die, like someone stabbed me, other than the car rides. The car rides were terrible. For my incisions, I have 4 incisions. He put one in my belly button, and that's the one that hurts the most. I assume that's where he actually pulled the stomach out. And actually, I've taken 2 showers so far, and now my incisions are starting to itch a little. I'm trying to just be careful and not itch anything. The other thing that's been helping me with my pain, other than obviously pain medication, is a binder. It's like the binder you put around your stomach. And I've been wearing this a lot at night because it feels like your stomach's falling out. Like you feel like you need to hold it. So I've been wearing that especially to sleep, and it makes me feel so much better. It just kind of holds everything in place, and it's been really helping me. So that's been really good with my pain. As for I've been getting shortness of breath sometimes after a nap. I'm sure it's because I'm not doing my little incentive spirometer often enough, but other than that, I haven't had any real issues. The first day I had a lot of mucus from being intubated, and of course it hurt like hell to cough it up, but after it was gone, it was gone. So I promise, if you're feeling any surgery pains, you're wondering what everyone else is feeling, I promise you it does get better. The pain from my first day to now has decreased so dramatically that I am just so happy with myself and I'm so proud of myself. So I'm super excited. So lastly, I'll show you my 4 incisions. I only have 4 because I assume maybe just because he didn't need any more. So I'm not going to get up because I'm lazy. So I have one here, my belly button, and then I have one here, here, and here. The one on my belly button is the one that hurts the most, but I've been surviving. Like, it's not too bad. So that's pretty much it for my day 3. I'll post again on my 1 week. Hopefully tomorrow he's going to clear me for full. Just depends on how many fluids I can get down today. My goal is to get down this whole Powerade today, which is only 32 ounces. We're supposed to get 64, but you know, little goals. So if you have any questions, let me know.